Without further ado, I'd like to introduce Jim McGovern first and foremost. The Congressional Study Group on Public Health has been around since 2007, working together with the CPH Foundation to organize public health briefings like these. We've been really lucky to have Jim McGovern come and kick off a number of them, as well as Bill Cassidy and Lucille Roybal-Allard as well. So thank you, Jim, for all the help with this.
Well, thanks, Carl, and I want to thank everybody for being here. One of the things that I do not think members of Congress appreciate enough is the role of public health in not only keeping people well, but in saving money. You know, we're all talking about deficit reduction and how do we get our debt reduced. If you get it right in the early stages, you don't have to pay for it in the later stages. And that's why today's briefing is particularly important. And again, this is sponsored not only by myself, by Bill Cassidy and Lucille Roybal-Allard as well. But this is a briefing on prenatal nutrition, which is vital. All the science tells us how vital it is. In fact, in a lot of our overseas development programs now, we're talking about the importance of prenatal nutrition as a way to, not only help promote the birth of healthy babies, but to keep people healthy in the first 1,000 days of their existence, and so we need to make sure we do that here in the United States. And we have some challenges because rather than expanding programs, we're actually kind of contracting programs, and one of the side effects of this whole sequestration business is the fact that we're actually seeing cuts in programs like WIC, which make absolutely no sense to me. And so I think if we can fix the airline traffic controllers problem, we ought to be able to fix the problem with WIC, and hopefully we get around to that business soon. But anyway, we have Dr. Colleen Boyle, who's the director of the National Center on Birth Defects and Developmental Disabilities at the CDC, who is here with us. Ms. Martel Esposito, public policy nutritionist at the National Women, Infants, and Children Association, and Dr. Daniel Rayton, nutrition portfolio program official, the National Institute of Child Health and Human Development at NIH. And before I turn it over to them, when I talk about the WIC problem, I'm not talking about the problem with the program, I'm talking about the problem with the funding. We need to make sure that everybody who is eligible for that program has access to it. And I think one of the challenges for those of us who are working on these public health issues is we need to brag a little bit more about the success stories so that everybody can appreciate their impact. So having said that, let me turn this over to Dr. Boyle.